Good afternoon, everyone. Lisa Homa here. We're on to week 5 lesson, Informatics. The objectives for this lecture are to define the role of the nurse in informatics, to discuss the laws and regulations that impact nursing, and to discuss the trends associated with electronic health records, e-health, and mobile devices, starting with Chapter 23. So what is informatics? It's a specialty that integrates nursing science with multiple sources of information management. To make it simple, nurses have to translate information into practice, know how to communicate using it, and improve patient outcomes. What are the duties of an informatics nurse? Now, this is a person who's specifically hired in a full-time role to do only informatics, but potentially, maybe you have an interest in that. There are master's degrees, there are certifications for informatics nurses, and by the way, they get paid very well, much higher than a staff nurse. So it's something to consider, and they don't often require an MSN. They usually are okay with a baccalaureate degree, so something to think about. So what they do is they'll do product evaluation, software product evaluation, like Epic versus Cerner systems. System implementation, so they'll work on go lives for those big, huge implementing Epic or those other things into a health system, which is a huge job. They could be on the training, the prep side, and they can support the end users, which are the healthcare professionals. They can work on system development, as we're noticing errors occurring in the Epic builds. Well, specifically with Epic, but other software systems as well, that there's many gaps within the system and that the interfaces are not as intuitive and helpful to staff as we would need them to be. It's like going through a sea of information. Each floor uses its own set of data that's important to them for that specialty. You need an informatics team for almost every single floor or department because their needs are so very different. Also, an informatics nurse will use system evaluations. They'll work on problem solving for quality and safety and patient safety issues. And this is what I was just talking about a minute ago. Improve efficiency of workflow. And this is a huge thing, is that there's a lot of data and information that we could use there, but we can't get to it quickly or quick enough to help us during patient rounds, for example. And we want to be able to illuminate the highest priority areas of the electronic health record to be helpful to us and not hinder our workflow. Regulatory and accreditation requirements. So the two most important requirements are dealing with HIPAA and then the Joint Commission. And so a healthcare organization has the responsibility to itself, the patients, and the community at large to maintain control of its information systems. Healthcare professionals rely on accurate and real-time data, personal data, and employee information. It has to be safe. It's not just about patients. Your information is in there also. Information should only be accessed when necessary. Most health systems in their security break the glass. If you are entering an area that potentially you should not be, hopefully they have something like break the glass so that you have time to consider what you're about to do. What is happening, California sort of sets the trends for us here on the East Coast, and Kaiser Permanente, they've been setting the standard for a number of years now. Went to Epic first a long time ago, and then now they're working on mobile devices. And that's kind of what we're seeing, is that the trend for electronic health records is moving to a mobile device, so that let's say I'm taking my patient to CAT scan. I don't want to drag a giant computer with me or use the computer down in CAT scan. I'd like the ability to have a mobile device so I can continue to chart in real time and be able to track my patient's vitals and slave them in through the mobile device. The problem with mobile devices is that we haven't found great security measures. We find that they're highly susceptible to privacy and data threats, criminal attacks, and then, of course, you have to worry about employee negligence. What if you leave your password up? What if you do all these things? So yeah, there's just a lot of different considerations with mobile devices, but it is the future. We are totally going there. Nurses need to be in control of their mobile devices also at all times. Plus, what do you do about multi-factor authentication, encryption, and then keeping the device clean and all of those things? So there's a lot of things to consider. The Joint Commission is very specific about the regulatory requirements that we need for accreditation. They want to make sure that we have clear written HIPAA policies, and there are serious violations for violating HIPAA. It's between 11 and 21,000 per hit of whatever the violation potentially could be. So it is a really big deal. and hospitals could potentially lose their accreditation, their Joint Commission status, for violating some of those areas. On to meaningful use and high tech. 2009, the government, through Centers of Medicare and Medicaid, as part of a stimulus bill, and the stimulus bill was actually called high tech. And high tech stands for Health Information Technology for Economic and Clinical Health Act. It was a stimulus bill adopted as a set of rules and regulations for the implementation of high tech. Meaningful use required. Let's say you have a physician's office. They need to now also have electronic health records as well. Many doctors' offices were still going by paper, but what they said is, well, if you don't go to some type of computer system or electronic health record, we're no longer going to reimburse you. So what the government says is they incentivize it. Yeah, they incentivized it because then now physicians would get zero reimbursement. So it became very important. It was also the push or the stimulus to get hospitals to implement Epic and other things like that, because now they need it to get that reimbursement. There's certain criteria that have to be followed in order to get that. It was a proposal meant to stimulate the national economy because there was a recession at that time, and overall to improve the healthcare quality. The U.S. has been behind in electronic health record, behind other industrialized nations in the world, and so this was an opportunity for us to try to catch up. Financially rewarded agencies that develop safe technologies for electronic health record and new patient communication strategies. The other thing we realized is that nurses are not very good at technology. And I crack up about that because we're really not. And our focus of our nursing school and all the things that we go through is on delivering excellent patient care. What they forgot to tell us is, hey, there's this thing called Office and Excel and spreadsheets and all this other stuff. So what they recognize pretty quickly is that healthcare professionals, they know their business when it comes to taking care of patients. They're not prepared for the technology side. Technology, informatics, guiding, education reform, international symposium. All these educators and global leaders come together from throughout the world, and they come up with very forward-thinking education plans on how to make sure that healthcare is safe, it's effective, it's efficient, and it's patient-centered. There are 9 competencies that Tiger focuses on: standards and interoperability, and I'll define some of these terms for you if you're not familiar with them in just a few minutes. Healthcare information technology, the national agenda and the policy. That's to make sure we're moving forward and we're all following the same policies. Informatics competencies, so what's the minimum thing that we need to do to stay competent and relevant in the workplace? Education and faculty development, staff development and continuing education, usability and clinical application design, virtual demonstration center, leadership development, and consumer empowerment, personal health record. There are basic computer competencies that every nurse should know. They should be able to understand the concepts of communication and information technology. They should be able to use basic computer and manage files. They should be able to do word processing or use Word. That's in Office 365. Should be able to do the most basic spreadsheet in Excel. Be able to use a database. Not relevant to everyone, but to some, of course. And then be able to perform a basic presentation in PowerPoint, and then be able to surf the web. So I mentioned point of care because it is a computerized thing and it's part of the informatics. It all goes together. The IOM came up with another report, Preventing Medication Errors, in 2006. They recommend greater use of information technologies in prescribing, dispensing meds at the point of care. So now we have the ability to use handheld devices at your fingertips. So if I'm on the computer, I can get Lexicomp or one of the other med sources so that I can look up all my things there. How about we use glucometers and we can instantly upload them or download them to the lab so that we don't have to manually input the numbers anymore. They automatically are calculated and put into the lab fields for us. So telehealth is being used to monitor patients from a distance. Like, what if you have a woman who is stable enough to go home, but yet still have to monitor contractions and things of that nature for people in preterm labor? All those things can be managed at home now because we have the ability to upload our technology and input it so that a physician can take a look at it from wherever they are. Or what if you're that person that lives in Iowa and it's 100 to 200 miles between major medical centers and they're are people who don't need to stay in the hospital, but yet they still require some monitoring. This is where informatics is working so beautiful and helping patients so that they don't have to those health centers. And the next is clinical decision support. It's a group of systems specifically designed to improve patient outcomes, promote patient safety, and reduce financial costs incurred in healthcare facilities. So a number of these, let me just give you a couple of these. Monitor watchers, it might not be someone who's even positioned on your unit, but let's say you have a lot of telemetry and you can't always stay on top of them. That would be a clinical decision support. That technology is viewable or available to someone else, and they can monitor, hey, somebody, your heart rate is too high or this is too low. They call that clinical decision support. Or they can monitor parameters for you, or they can let you know there's an abnormal heart rhythm or that something is going on with medications and barcoding. Another thing is we had so many problems with physicians and really messy handwriting for a long time, and now we have computerized physician order entry, which is wonderful. There's no more questioning exactly what that order is. Physicians have to be very careful the way they input their orders, and it has really been a great patient safety event that has happened with that. Then there's regular order entry, so that we know all kinds of things. Temperature monitoring, anything. There's no more terrible chicken scratch that we're trying to interpret. It's already there for us. E-prescribing is also a big deal. Again, physicians' terrible handwriting, can't tell what they're putting down on the script. Now it goes right to the pharmacy and it's very clear what they need. And the multi-parameter alerts I already explained. Clinical information systems is just all the other things. So we have the patient's chart, but then all the additional data that goes into electronic health records. It's how the hospitals get paid with billing. It tracks insurance. It tracks other types of data, anything they want. Again, e-prescribing, mostly there's a lot of tracking happening with the opioid epidemic that's going on, where they want to make sure also that physicians are not ordering 600 Percocets for someone. They're trying to monitor physician practices as well. And then again, digital communications. And then informatics key terms. Think you're so good? How about you define these? So I wanted to make sure that you're familiar with them. No test, nothing like that, just to keep you informed. Interoperability is just the ability to speak to other computer systems or software. An example of this is, let's say St. Luke's Hospital in Bethlehem uses Epic, and also Lehigh Valley also uses Epic. Now you still have to request permission, but you can see a chart. And the reason why this is so great is, what if you have a narc addict who is shopping around all the emergency departments looking for Percocet? We would never be able to track that before, but now we know, hey, this person was there at such and such a time, and this physician gave them Percocets. And now, hey, this is 2 days later, they're asking for more Percocets at a completely different health center. Good to know. The other thing is, what if you're in a car accident somewhere, you're traveling, you're on vacation, and somebody needs access to your records? This is the perfect way to have this happen. Secondary data. It's the use of data or documents that have been collected for another purpose, such as data in a medical record. It could be collecting billing or statistics about obesity or who knows, whatever. But anyway, it's data that represents the same piece of data for many different records. And so that could be, for example, let's say a physician's practice wants to know, how many surgeries did we do of this type? How many gallbladder removals did we do in the past 30 days? And it's a perfect way to pull data for surgical reports, problem-oriented medical record. It's a multidisciplinary medical record that's organized by the client's problems, with disciplines starting in the same place for each problem. And most epics that I've seen or I've worked on are organized in this fashion. Next is Deidentify. This is a great word to become familiar with, especially if you're thinking about going on to school for your master's. The official informatics Deidentify word. It's the process of removing any information from aggregated data that could be used to identify that person about whom the data was created. This is Listserv. A listserv is just an electronic mailing list whose software forwards all messages to a full group. And then a graphical user interface. We use these all the time, but I don't even know if you knew what it's called. It's just a way of interacting with a computer in which the user makes selections from images called icons. it's good to know the technical terms. That's all I got. Thanks for listening. Have a great rest of your day.